The indications for manual hyperinflation are for secretion clearance and to help with lung atelectasis, normally in the presence of secretions. The absolute contraindications for manual hyperinflation is an undrained tension pneumothorax. The precautions are bullae, surgical emphysema, recent lung surgery, rib fractures and flail segments, frank hemoptysis, raised intracranial pressure, cardiovascular instability, and high PEEP settings. This may be discussed with your local consultant team to decide when treatment may be appropriate.
I'll turn on the flow, and I'm going to turn on the suction, so that's connected there. Disconnect from here, attach to the ventilator, from the ventilator onto the patient, and we're going to take a couple of gentle breaths, a gentle breath, then a deep breath, and out again. Let the bag expand.
When completing this treatment technique clinically, best practice would be to monitor your pressures during the treatment. Depending on the trust you work in, this can either be done through the ventilator or via a manometer. Ideally, you need to be cautious about your pressures in order to prevent barotrauma during treatment by delivering too much pressure on each breath.
Deep breath and a sharp release.
In clinical practice, at this point, you would open the valve on the manual hyperinflation bag whilst the patient is having the closed suction so that any pressure from the cough can be released into the bag.
Suction's
Yeah,
on.
just going to turn the suction button on. And then insert the tube. Withdraw the tubing. Cough.
Cough, cough, cough. Couple more recruitment breaths afterwards.
During your treatment, you'll also be wanting to keep an eye on the monitoring screens in the patient's bed space to be aware of heart rate, blood pressure and oxygen saturations to make sure they remain stable during treatment.
And back onto the ventilator.
Okay.
As you can see here, there are two lengths of suction catheter within the closed suction unit. This depends on whether the patient has an endotracheal tube or a tracheostomy, as the internal length will be shorter for the tracheostomy compared to the endotracheal tube.